Good morning, everyone, and welcome to our webinar, Navigating Medicare, AHIP Training and Market Shifts with AIM's Don Erickson. Today's webinar will be recorded and then later posted on our website. This does mean that all attendees will be automatically muted so that we get a quality recording. If you have any questions, go ahead and type them into the chat box and we'll try to answer them throughout the presentation. But if we're unable to get to all the questions, we'll have a member of our marketing team reach out to you individually to make sure you get that answered. Before we get started, we'd like to invite you to join us for our next webinar on Tuesday, July 8th at 9 a.m. Pacific Time. Join Mike Anderson for Long-Term Care Need versus Necessity by registering at yaim.com/training. And with that, I'll hand it over to Don so that we can go ahead and get started. Take it away, Don.
Thank you, Jordan. Good morning, everyone. Don Erickson here with AIM today. Hope you're all doing well. Today, we're going to talk about the roller coaster. It has begun already. AHIP has started their training and Medicare world, and so we want to make sure everybody's kind of aware of what's going on, the differences, and that's why it's navigating through Medicare, the AHIP training and market shifts. Really talking about cross-selling when you're talking about the shifts and what's going on today. So today's agenda, AHIP and Medicare, the 25 Medicare market and the disruptions going on, the Medicare Advantage world and training, cross-selling, bundling, and filling the gaps. That's a big thing we're going to talk about today when you're talking about Med Advantage. There's many gaps that they're co-pays basically, and you want to make sure you're taking care of those. And also the products and carriers that will do that. AEP is just around the corner, October 15th through December 7th. That's when everybody knows that we write a ton of business through that period. So we all know, without saying, the roller coaster time of year has begun. First things first, with everything going on right now, everyone getting their certifications, trainings done to prepare for AEP, we want to make sure that you have everything in good order. And I'm talking about getting your appointments. For the carriers, you'll want to make sure you add to your portfolio before the madness gets here. The reason I mention it is once AEP starts in October, we get a lot of delays with appointments just for the time, and as people are getting it in, and you want to make sure you have that done before you actually can write business. So that's a big part of it. Compliance goes right along with everything, and you're not able to sell the product unless you have your compliance done for the product training, the AHIP, and everything all together. So let us help you with that between the training, the carrier products, compliance, and so the time is now. Quickly go over the elimination periods for the supplements during AEP. You have your Annual Enrollment Period, AEP, other known. You have the OEP, January 1st through the 31st of March. Year-round is special enrollments, and then you have the IEP. So 7 months period before varies per person. So you have the October 15th to December 7th, January 31st, or January 1st to March 31st, year-round. And so that's just a quick breakdown of the elimination periods for this time of year. So you're going to have marketing tools that we have to help you with the Medicare world. So when you go into YAIM, our portal, you actually have access to many tools from the CSG quoting, training webinars. You have also the integrity dashboard that has Medicare Center, Lead Center, so you can actually buy leads in there for to grow your business. Lots of things that we can do to help you with your business during that time of year. We know it's busy, so we want to make sure everything is easy access, I would say. Also, there are market disruptions. We all know those. Rate increases across the board. One carrier between another, their average is quite steep this year. And I don't see anything that's going to slow it down. So what we want to do is most of our carriers have a 12-month rate lock. We want to make sure that you're fully aware of that. So let's say in Washington, you can move pretty much from month to month on different carriers. So if one did have a rate increase, we want to make sure that you know that you have a 12-month lock once you write that. And once that's over, you can change to another carrier. We've seen it happen a lot, but when you're working with Medicare Supplements and Med Advantage, you want to make sure you have all the opportunities you can to help your clients. Carriers leaving. We've seen carriers already leave the market. The last one we know of that was in June was Allstate. They're actually leaving the market for Med Subs, and they haven't left yet. They can still do paper apps, but once they file for the states, they will be out of the market for good. So more plans that have either for PDPs, they've left it with no commissions for a lot of those, or reduced commissions for others. Then there's the contracting, transfers, and blackout dates. We want to make sure that you're fully aware that if you want to move to us, we have everything under the sun for carriers and products, from Med Subs, Med Advantage, PDPs. So we want to make sure you're fully aware we do have all those available for you, for your access, that you can come to us and we can help you with that business. But there are blackout periods, so we want to make sure that you're fully aware that there are those. So let's get the contracting in so we can help you move that over and have a smooth transition. How do we get to this point? Well, this year, just like last year, we're seeing a lot of disruptions already with different increases, comps not being paid, but Med Subs pricing hasn't kept up with expenses. The Advantage plans are throwing a lot of benefits towards customers to see if they want to go that way. 13 of eligibles switched coverage from 24, and those numbers are expected to grow again even this year. So let's make sure that we are fully aware of what's going on. We're here to help you. So then you have the opportunity for 2025. And fall is definitely shaping up to be unlike anything we've ever seen before. Last year was, let's just say, interesting, but just look out for what's going to happen. It's going to be another large year for everyone. Will the supplement plans and Advantage plans share the same benefits, or stay even? I'm sorry. Who knows? We're not sure with all the disruptions going on, but we want to make sure that we have all the opportunity in the world to make it work for you. This might be the year to start traditional conversations earlier, seeing that people, before open enrollment comes, make sure they know Med Sub and the difference with Med Advantage, see if they want to go back to Medicare Supplements if they have the Med Advantage plans. Then the PDP market, it may be a very big opportunity, more than you think, with commissions going away, and then the different drug plans that each one have. Due to all that, we can wait and see what happens with that product also. The Inflation Reduction Act was actually signed in August of 22, emphasis on benefiting vulnerable populations, Medicare emphasis on benefit expansion, stability, or stabilizing for PDPs. PDP benefits are a big market every year. And so with that, we want to make sure that you know which ones are available that we have. And then also, if you're going to get any commission at all. Like last year, a lot of the carriers stopped paying commissions on them. So it's hard to help clients that you're not going to get paid on, but when you help them with the PDPs, that does create other business, the Med Advantage or supplements or other products. So, carriers getting out of the market. Again, how many this year? That is the question. Who's going to be leaving? Who's going to be coming in? It's kind of like stepping up. Who's next in line to help? So let's make sure we all know where we can help. With the Inflation Reduction Act, here are a list of benefits established with the Inflation Reduction Act, just so we know and we can let you guys be aware what has happened and what is going forward. So you have the out-of-pocket costs on PDPs capped at $2,025. The insulin costs, of course, capped at $35. The coverage gap, the donut holes, finally have sunsetted on the Advantage plans. PDP benefits, we really will have to look and see what plans are offered again this year for next year. That'll be a big thing on which ones are actually sold. Low income subsidies, adult vaccines, with no cost sharing. MA and MAPD clients out of pocket can pay monthly basis. Direct drug plans negotiated for Medicare and inflation rebates on pricing. Quite a bit of information there, but these are just a few things that with that Inflation Reduction Act benefits. Why Medicare Advantage now? So a big part, PDP changes drive shoppers. It's going to be another season of a lot of people moving. The market share is now over 50% that we've seen from Medicare Supplement to Advantage plans. The average beneficiary has very much grown to how many options they actually have access to. So that's going to be another thing that, what's the best fit for which client. We're going to have to make sure that we know all the different plans. There's a lot of ways we can look at it, but give us a call if you have questions on those. The high cost of change of cost, the rate increases expected with supplements. We've already seen that already at the beginning of this year, and it's going to continue with carriers and the rate increases for what they're going to be having. So substantial rate increases of what we've seen across the board. But give us a call. We'll make sure we have the right fit. We have many carriers to do that with. And so we'll go over that more later on also. Expect 4 times as many shoppers this year just because of all the changes, all the disruptions. There's going to be a lot of movement again this year, which can be very beneficial. You're going to do well with commissions, but finding the right product, the right carrier for each client is going to be the key. So, of course, keys for the upcoming season, the preparation for the future, which supplement carriers or which supplement clients are going to get the biggest increase of your book. So making sure you're fully aware of what your client has right now of your book of business and making sure that you're looking to see where you can help them the best for rates. Which Medicare Advantage markets are changing. Another kind of the same kind of thing we're talking about in this thing is there's so many changes going on, so many disruptions going on. The options for your Advantage clients. So big key things. What's going to be the plan they need to go to this year? What are they going to move to? Who are they going to go to? Who's going to be in the market? It's all kind of an umbrella of it's going to be going kind of loop-de-loops or crashing the waves, you want to say, however you want to say it. There's going to be so many things going on. Just take one thing at a time. We'll walk you through it. If you've got questions, give us a call. But make your contracting also your decisions for what carriers you are looking at to bring on this year, moving forward. And then the biggest things are being compliance. You got to record calls. If you're talking about benefits for Advantage plans or PDP plans, you have to have that available. And so talking about that compliance thing, we have the answer for that through the Integrity Medicare Center or Integrity Dashboard. They actually give you a phone number for your own, for you to use. So when someone's calling in, it actually will be a recorded line that you get a personal line for you when you actually work with us and use that Integrity Medicare Center. There are so many advancements that they've actually upgraded this year and even as of last year. So talk to us about Medicare Center. See what's available that you can use, how you can use that for your own database for your clients. There's a lot of information there, a lot of great tools that we have for access. So we want to make sure you have access to all of them. So the Medicare Advantage plans, PDP plans, with all the things being said, here's a great variety of Medicare Advantage carriers offered through AIM. For some reason, a lot of our agents didn't even realize that we offered Med Advantage plans, which over time, we've actually grown into this market quite a bit. So we're just making sure everybody is aware. But we have many products and carriers to help almost every situation. So as you can see, we have the names, the household names, Humana, United Healthcare, Aetna, as you see on the list, there's a good selection. We pretty much have it across the board. So if you are looking to come on for Advantage plans, you don't have someone that you're working with, or you want to move from where you are. Let's just say that it's not a great situation, you're not happy with them. We are here to help you. So let's make sure that we give you and you give us the opportunity to help you with growing business for yourself. So AEP, it's right around the corner. AHIP is very time consuming and not always easy to get through. But if you're selling Med Advantage and PDP plans, it's required. And on top of that, any carrier that you're selling, you have to have their product training done also. So it's not just AHIP. So if you're going to bring on United Healthcare or Humana or Aetna, you have to do their product training also. It's required to sell the products. We want to make sure that you have everything in good order, so you're ready to go out when AEP starts. Nothing would be worse than not being prepared. So on that, did you know only about 1% of Medicare Advantage policyholders have a hospital indemnity plan? This is a great opportunity for hospital indemnity. The policies are designed to cover out-of-pocket expenses in your Medicare Advantage plans. So we're going to talk about cross-selling in real short in a couple of slides, but this is a great opportunity, like I said, for hospital indemnity. If you haven't heard about the hospital indemnity plans, so then hospital indemnity plans grow your business. Let's just say you have 100 Medicare Advantage prospects, and on average, the closing rate is about 70%. That is an additional 70 commissionable policies that you have access to actually go back after AEP or during AEP and actually sell them another plan to fill some gaps. Hospital indemnity can be sold all year long. It has great first-year commissions. Renewals are paid mostly for life of the policies. So this is actually, like it says, keeping cash flowing all year long. Protect your book of business, and you can also generate referrals with this. So Advantage, copays, and hospital indemnity. In most cases, it only takes one short hospitalization event to actually realize the true value of a hospital indemnity benefit. We have one carrier that we have that can be used multiple times per year and over the lifetime of the policy. There's no limits to receive lifetime benefits for this. So that's huge. You being able to fill a gap that an Advantage plan has and no out-of-pocket expenses. So it's really why cross-selling hospital indemnity. A meaningful improvement for clients' financials. The average bank account, roughly from a 55 to 60-year-old, is $8,000. How many times is that going to take over $250 a day for an Advantage hospitalization copay before the savings is literally gone? So we really got to think about how that's going to help them to bring on other plans. So Med Advantage is a very good plan for seniors. However, if you also offer them a chance to lower their net out-of-pocket hospitalization cost to zero through a hospital indemnity plan, you immediately become more valuable as an agent to them as you're looking out for their financial well-being too. And that creates referrals just by word of mouth that you're looking out for their best interest. If you have one client that actually goes to the hospital, uses this plan, they're going to talk about it to other people, their friends. And if they're the age that they actually have these events, that's just unlimited that the word of mouth is going to spread like wildfire. So huge opportunity. So the cross-selling puzzle, if you look at this, it's a design that it's really simple. You have Medicare Supplement and Advantage plans in the center. When selling Medicare Supplements and Advantage plans, this is a nice way to look at it. All the products go together very easily. You have Medicare Supplements, you have dental, you have final expense, but big one is Medicare Advantage, just straight below it, hospital indemnity. What it can do for clients and their budgets, because we all know they're on fixed budgets, just to help them and complete a policy that will cover everything and not leave them with gaps and like, how are they going to cover this expense for going to the hospital? It happens. People go to the hospital all the time, and as they age, with medical enhancements, people live longer, so things do happen. And so we want to make sure that we have coverage for them and do the best we can for them and help you with the best products that we can. So it's saying that this is a list of our hospital indemnity carriers that we actually have here. When you're looking for the right fit, the options, the benefits, you have the GTL, the Guaranteed Trust Life. Wellaby has theirs, United American, Heartland, Aetna, Cigna. So people may see a name that they actually have. They may have a Medicare Supplement or an Advantage plan through Cigna or Aetna or United Healthcare. And they'll say, hey, this is who I have, or my friends have this. Or you also have people that are healthy and can get through underwriting. So a lot of them don't have a lot of underwriting, but there is. But there are also guarantee issue windows. So there are carriers on here that only have actually 4 questions, or they have a guarantee issue window of an age from 64 to 70 or 60 to 79. So if they have health issues, they can actually get this product with no underwriting. When you age into 65, there's no underwriting with a lot of the carriers. So we have them that have underwriting and non-underwriting, but we want to make sure you're fully aware that people that have health conditions, they can still get this product. We want to make sure they're taken care of. So going into cross-selling and advantages for them, when you're working with your clients, make sure that you always look out for their best interest. I say this all the time. I talk to agents every day. That's our number one job, is looking out for their best interest and selling the good policy. Don't leave the table without asking at least the question to make sure you can help with them. Selling one policy, they may be able to be swayed away. If you're talking about a supplement or advantage plan, someone else says it has the same thing, but they have a PDP that may go with it, or a hospital indemnity. But if you're talking about a couple policies, you actually write that advantage and you help them with a hospital indemnity. It more creates a long-term relationship with them. You're looking out for their best interest, so they're going to actually know this and realize that you're not in it for yourself, but to help them. That's our job as agents and marketers, to do the best we can, and it's basically our moral responsibility that we're supposed to be doing that in the first place. But it's win-win for both the client and you. Bundling is commonly known. It's also same as cross-selling, but we see this in examples every day without even thinking about it. Just look at the airlines. What do the airlines do? They, expedite boarding. They have free baggage checks. They have extra leg room. These are just kind of different things, how you don't even think about it, but they're cross-selling or they're bundling. And that's the same kind of thing you'll want to do with the Advantage plans. Don't leave them hanging with those copays. Definitely at least talk to them, look at the hospital indemnity. Movie theaters, it's those things that, you're going to get popcorn. You're going in to watch a show. You're going to have something. That's a bundle. Okay. When you're moving, you always need boxes. Well, U-Haul, hello, they have you go into their shops. Have you ever been in there? They have the cardboard boxes. They have the tape. They have all that stuff. So my point is, when it comes to cross-selling, fill the gaps with products designed to do that. So we have the products, we have the carriers. Let's make sure that we do the best we can. So the other cross-selling pieces, or we all have dental. Everyone knows that dental is everybody wants to. We need to have our teeth worked on. This is a constant ongoing thing. So dental products are another cross-sell. They go right along with Medicare supplements. When you sell a supplement with one of our carriers, I know for a fact that you'll get I believe it's a 15% discount if you write a dental plan within 30 days of your Medicare supplement. You'll get a discount on your dental. We have another one that we have that has a actual $10,000 benefit per year. It's not in every state. Most states it is, but there are a few that are not available. But $10,000 benefit a year for dental if you have implants. How many different things you'll need done for your teeth? I know personally, I just had a filling that had to be fixed, a root canal that has to be taken care of. But to have that benefit, and with that $10,000 benefit, there's a one-time annual deductible of $100 lifetime. So you have one-time deductible, and that's it for that plan. And the premium's right around $88 a month. But for that kind of benefit and that kind of premium and a one-time deductible, for me, it was kind of like a no-brainer, But in Washington, it's not available. But there's a lot of other states all around us that it is. They may come into Washington. We will see. But lots of cross-selling with different products. The Medicare supplements, so here's a lineup of our supplements, from the household names to all the other carriers with the possibility of the lowest premiums. With Medicare supplements, we all know a Plan G is a Plan G, but clients that are in a strict budget that they have will shop their premiums, and we have it all covered for you with all the carriers that we have. The Mutual of Omaha's, the Aflacs, the Aetnas, but the ACE Medicare Supplement, we're actually having them. They have been huge for us this year and the last couple of years. Woodman Life, they're actually administered by Mutual of Omaha. If you did not know that, you actually go onto Mutual's portal, you write them right on their site, right along with Mutual of Omaha. Wellaby, that's the new name. It's it's Medico Wellaby, if you don't know that name. United American, if you have older clients, I tell you their rates are excellent for older clients. So if you have an older book of business, ask us about United American or the others. It just depends on the situation. It's all about zip code. It's all about areas where they are, but having the right price for your clients. You don't need to have 10 Medicare supplement carriers, but I recommend that you have 2 or 3. Let's say that. So you have the household name. You can have that, but also have the lower of the premiums. Most of them are all A-rated, but make sure you're covered so your clients aren't going to be going and shopping somewhere else and say, well, you didn't have this carrier, so I went somewhere else just because of a premium. So let's take the time to make sure that we are fully prepared for this year and having the carriers, the premiums, everything. We want to make sure that we have it all in order for you. There is another product, short-term home health care, I wanted to make sure I did talk about today. There's another also carrier or another product we'll talk about, but short-term home health care. There's only 4. One carrier has 4 questions. It's really, can you function the daily activities? Do you not have dementia or Alzheimer's is a question. And are you in a facility already and getting home health care benefits? If you can answer those 3 questions, no, you can get the product. But everyone wants to stay at home. And with this product, with home health care, you can. So it's short-term home health care. We have them through Aetna, through GTLs, to mutuals. But let us help you with the whole product lineup, not just the Advantage, not just the supplements, the hospital indemnities, but there's a full line of products we want to make sure you have. There's final expense. It kind of speaks for itself. We all know about final expense and what it does for us. With final expense, I'll just say that we have underwritten products, with lower rates. They have level and graded plans, but there are also 2 carriers that we have that are guarantee issue, Corebridge and Gerber. So if you have clients that are not healthy, we actually have a place for them also. It does cost a little more in premiums, but there's no underwriting questions at all. Bonuses. So if you're actually writing business, why not get paid a little extra? You don't know how many different bonuses. There's so many different ones going on all the time. Third quarter bonuses are going to be coming out. There's Medicare supplement bonuses. There's hospital indemnity bonuses. There's just a total number of bonuses that we can help you out with. So if you're writing a business, you're going to get a little extra, which is nice. You're writing it, so why not be able to benefit off of that? So we want to make sure that you know all the different bonuses. It's always in the next slide, which I'm going to talk about, our newsletter. So if you don't get our newsletter, let us know. Give me a call, email us, call AIM, say, hey, I haven't seen the newsletter. There's a lot of information on there. I mean, it's from what plans going on for what's the best premium, what bonuses are going on, the webinars that are coming up. There's all kinds of information that we put into this. Our marketing coordinator, Jordan, I mean, she does a great job making sure there's enough information that keeps you up to speed with everything that is going on. And if there's not, we make sure that all the marketers here are feeding her information to help us build this newsletter that goes out every week or every other week. So if you don't get this, you can register for it. You can call us. We can get you on the list for it. But we want to make sure that you're fully covered with all the different stuff we do here at AIM. But with that, I want to thank everybody for being here today. We're all busy. We know that AHIP's going on, the product training. AHIP's a huge thing. I'm actually going to be doing this myself this year, so we'll see how that turns out. But that gives me more information to help you and helps our team to where we can help you with questions that if you have them, we're here to answer them. There's just so much going on. We want to make sure that we're here to help. So like I always say, I'm always here to help. Well, our whole team is here to help, from Nisha, Derek, Chris, Alex, Mike, licensing. If you have licensing questions, we will make sure of that. If you got new business questions, give us a call on that. But I will be actually reaching out, and the other marketers will be reaching out later today and tomorrow to go over any questions you might have. But with that, everyone have a great day, and we'll talk to you soon.